So, on the same vein of inspiring hope, we're very excited to go into our next session, which is our patient panel. These four folks have been willing and brave enough to share their experience about their clinical trial that they have been a part of. And I'm going to hand it over to our partner from Wendy Walk, Meredith Berger, to help introduce this patient panel. So, Meredith, I'll hand it over to you.
Thank you, Tim. Thanks so much. It's great to be here. So this will be our third patient panel. The last 2 years, I had the pleasure of moderating, but this year we have a special guest. She formerly was a patient panelist from a prior panel that we did, and she has firsthand experience with clinical trials, which is amazing. And she's a seasoned moderator due to her important roles with the Cactus Cancer Society and also the Desmond Tumor Board. And I'm so thrilled to introduce Christina Kosyla. And thank you so much, Christina, for agreeing to do this. I'm so excited to hear from this year's panelists. And it's all yours now, Christina. Thank you.
Well, thank you so much for having me, Meredith. I'm so excited about this panel. I have said time and time again that like my doctors have worked on healing my body, while it's communities like this one that work on like healing my soul and my spirit, because this is the worst club with the best members. I love finding out more from other sarcoma patients about their experiences. So thank you so much for having me, and I'm really excited to dive right in. So a bit about myself before I introduce you all to our incredible panelists who have so many varied experiences, who will be talking us through their clinical trial adventures, let's say. I know everybody has a different relationship with the word journey, so I'm going to try to step back from that one a little bit. A little bit about me. Meredith mentioned this, but I am a sarcoma patient myself. I have a soft tissue sarcoma called a desmoid tumor, and I was diagnosed back in 2018. And I have been so fortunate to receive really incredible care. I am now a board member at the Desmoid Tumor Research Foundation. I work as the programs and operations coordinator at Cactus Cancer Society within the young adult cancer space, which is defined, which in the way I love, 18 to 45. So you will find me up until my 45th birthday being, I'm just a baby. I am just a little, young adult patient. I have benefited from a clinical trial, and you're going to hear a little bit more about that from me as we go down the line. But let's turn it over to our panelists, who I know I'm really excited to talk to. So let's start with Wes. Hi, Wes. I'm hoping that you can introduce us first with your name and your type of sarcoma.
Yes. Hello, everyone. I'm with Sam Matewi. I do have been diagnosed with Ewing sarcoma on my second treatment, currently in a clinical trial at UCSF in San Francisco. The clinical trial was supposed to do 12 sessions. I'm actually just completed session number 23. So things are going well in that sense. So we just agreed to continue the clinical trial until further notice.
Oh, that's fantastic. Congratulations. That
Thank
is
you.
a true accomplishment. And we're so glad to see you today. And thank you for sharing
Thank
your
you.
time with us. We'll be getting into the nitty-gritty more about that trial and your experiences with it. So for right now, folks, if you have any questions, know that we probably will be getting to them, but also feel free to put them in the chat. I want this to feel like a conversation. It's a lot more exciting than me just talking to my screen at home. So next we'll go to Ashley. Hi, Ashley. So happy that you're here with us today. Could you tell us a bit about your type of sarcoma and where you were treated and your clinical trial?
Yes, and first I just have to say I'm a huge Christina fan. Uh, I've known her through social media for a long time, and I'm so grateful to see her lovely face again. Yeah, my name's Ashley. I had a spindle cell rhabdomyosarcoma in 2020, and I did a clinical trial with Kaiser Permanente, but
Mhm.
I was in the control group, so I didn't have the experimental medication, and I got the standard treatment that was compared against a new medication. Yeah, and I have been sarcoma free since 2021, 2022, which is really exciting. I'm super grateful for that. But I've been kind of a part of the advocacy groups since then, off and on. So really happy to be here. And yeah, glad to be a part of this awesome group of people.
Well, we are so grateful for your continued advocacy. And, spoiler alert, I'm a member of your fan club as well, if not the president. So thank you so much, Ashley, for hopping on in. And I'm sure there will be questions specifically about the control group that people will have. So we'll dive into that more in a moment. And last but certainly not least, we're going to hear from Brad. Hi, Brad. Tell us about your diagnosis and your relationship with clinical trials.
Hey, thank you, and I wanted to thank everyone here because without all of you, people like me wouldn't have much hope. So I appreciate everyone and my fellow fighters. I was diagnosed with, and I can't even pronounce it, and I can't spell it on purpose because I don't want to give it credit, honestly. Epithelioid sarcoma. It's a soft tissue sarcoma. And I made the mistake of not going to a sarcoma specialist for the first 2 years, and it was brutal first 2 years. Stage 4, it spread from. It initially started in my groin, and then it just metastasized to my lungs and everywhere else, practically. Then I was told about, I'm in Memphis, Tennessee, but then I was told about Washington University and Dr. Van Tyne um, in St. Louis, which is about 4 hours from me. And at that point, I didn't have many options left. I got sepsis. I almost died from sepsis. And I went there to see Dr. Van Tyne, and I was just like, what do you got? And he's like, well, we got this trial going on. And it was, I'll go more into details, but it was an immunotherapy trial. And within 2 years, I was clear.
Wow.
Yeah,
Brad, that's incredible.
thank you. Thank you. And this was 2021 is when I first saw him. I've had some issues,
Mhm.
some surgeries, but for the most part, I'm still pretty clean. There's a couple little stubborn areas that I keep having to deal with, like on my scalp.
Mhm.
But hey, it's way better than, I mean, my last PET scan was pretty good. I mean, really, for the most part, probably my best PET scan in 6 years, but there's still a little bit more work to do, which will probably be done. I've been on treatment for 4 years, monthly infusions, with some breaks in between. But it's definitely those last holdout areas is definitely kept them from growing. So, yeah.
Well, Brad, we are so grateful that you eventually landed at a sarcoma specialist. Thank you so
Mm.
much for joining us today. I know that we're already hearing in the chat from Nancy, same thing, 2 years of brutal, I imagine, a treatment before going to a Stanford specialist. So if there's an immediate takeaway already that you have, this whole group, you're hearing from us here, get to a sarcoma specialist because they
Yeah,
are your best chance at getting the best treatment for you. So
definitely.
thank you so much, folks. So I think one of the questions that is on everyone's mind, and one of these kind of bring us back to where you were. How did you discover your clinical trial? So, Brad, I know that you had just said that it was really your oncologist in St. Louis that was able to say, this is what we have for you. So, was that the first time that you had heard of clinical trials, or what was your relationship with them, and how did he introduce that conversation?
Yeah, well, I went to a standard cancer, like every city kind of has the place to go. And
Yeah.
I'm not going to name that. I'm not going to name that place. I mean, there were some good things about it. There were some not so good things about it, but they treated me, I guess you would say traditionally. I went through the
Mm,
chemo, went through the radiation. They were kind of like, well, this is kind of like what they do with sarcoma, so we'll just do that. I was completely blindsided by my diagnosis. I didn't have time. to research, and I was just trusting them, and it was metastasizing so fast I didn't have any other options, and I
Yeah.
was scared to death. I didn't. I realized the moment I started researching, it just ran up my anxiety. So, long story short, after just bad scan after bad scan, my doctor at this facility was like, "We don't have anything else to do for you." And then he suggested it, and I was a little annoyed thinking back that I was like, "Well, why didn't y'all tell me this 2 years ago?" You
Yeah.
know? But at the same time, when I told Dr. Van Tine that's how I was feeling, he said, "No, don't think like that. He's a good doctor because he sent you here." So,
You know what? That is a beautiful shift of perspective, but like we have to honor the both and, right? It's very human, especially when it's our lives that's kind
yeah.
of in balance. Of course you would feel that way, right? But I'm so grateful that he pointed you to a specialist who was really able to offer you something so life-changing. Ashley, let's hear from you. And I'm especially interested because I know a bit about your story, but you were a minor, like a legal minor before this. So can you remind us of the age you were when you joined your clinical trial and who was the one that really found that for you?
So interestingly enough, I was a young adult, but I was treated in a pediatric center because
Hmm.
my cancer was mostly for or had been diagnosed in children. So it was really, really
Yes.
interesting to be there with all the kiddos, which was really heartbreaking. I remember the first day of chemo, I went in and it was the middle of COVID, so nobody could go with me. And I saw all of the kids and their parents, and I just started sobbing. And because I was over 18, nobody could go with me because of the COVID restrictions, but everyone had a
Right.
parent with them. And I remember them saying, like, you can let her best friend in because my best friend Maris had come, but she was in the waiting room. So then she got to like come in with me like a parent, which was really special. Um, but they offered me the same clinical trial that they offered the kids, which um, I'm trying to pronounce. Temsirolimus was the name of the medication. I like had it written down. Um, as the it was an inhibitor, I think also an immunosuppressant. And I was
Hmm.
really bummed because it was a randomized trial. And so I couldn't pick if I got the experimental medication or not.
Right.
And so I was really disappointed hearing that I didn't get picked for the new medication and I had to do the gold standard carrot treatment, which
Hmm.
ended up not working. I also, similar to Brad, went to just a normal hospital and went
Right.
through years of chemo and treatment that didn't shrink the tumor. And it wasn't until I found someone on Instagram, Dr. Sang through USC, that I was able to get a second opinion, get a limb sparing procedure. They were going to do a quarter amputation on my arm because they didn't want to try and remove the tumor.
Yeah.
But a sarcoma specialist I DM'd on Instagram was able to perform the surgery. And then I did some follow-up chemo and radiation to get any leftover cells. So yeah, really big experience. Got to meet so many amazing families who were going through it as well. And kind of finding my way to the clinical trial and realizing also being in the control group was okay because it's a
Mm.
crucial part of the clinical trial process to know how the medication compares to standard treatment. So at the end of the day, I found peace in it. But at the beginning, it was a tough thing to hear.
Yeah, absolutely. And again, like we can't deny that human experience, that emotion that came up, of course. But when we're looking at how these drugs, eventually pass and get moved into commercial distribution, like that
Hmm.
that is the important part of the process. So
Yeah,
I think of the people like you, Ashley, who were willing to stick it out, who were in the control group, and who have contributed to the success of those of us who have been able to receive the drug. And
thanks,
I'm so
Christina.
grateful that somebody was willing to bend the rules for you and send your best friend
No,
in.
I
It
know.
must have been an extraordinarily overwhelming time. There's never a good time for a diagnosis, but like at the beginning of a global pandemic or in the midst of
Yeah,
one is far from ideal. So thank you,
yeah,
Ashley, for giving us more insights. And again, the power of social media, folks. There's so
yeah,
many other ways
crazy.
to do it than just grabbing new recipes or seeing cute cat and dog videos.
Um,
Yeah,
Thank
it's
you
been
so
amazing.
much.
Thanks.
And Wes, I'm really excited to hear about your trial because you now have gone above and beyond the standard number of cycles. Can you
Yeah.
tell us more about that and how you found it?
Yeah. So my first, I guess, my own journey with Ewing sarcoma took me to Stanford Hospital in Palo Alto. That's where my Ewing sarcoma was uh, pretty much touching T7 in my spine.
Mhm.
I did my entire treatment there, and I was in remission with a 30% chance that the Ewings would come back. And unfortunately, after 2 years being in remission, it did come back. So my oncologist at Stanford, Dr. Ganju, was aware of a clinical trial being done at UCSF, who it's being studied or ran by Dr. Manga at UCSF. So it was a really quick, easy handoff because
Nice.
luckily for me, both oncologists know each other. As but Ewing's being so, far and few between, there's the amount of oncologists that study it too are not as many. So it's unique that they both know each other really well, and have plenty of conversations about myself. So it was a great handoff where I just went from one oncologist to the other, and now I'm in the clinical trial at UCSF.
Well, I'm so happy to hear that. And I've been lucky enough to be in a similar boat. You know, when you have something rare, it does tend to be like you have like the rock stars in their field and they all
Yeah,
know each other. It feels a
yeah,
little bit like high school, how I imagine like all the popular
yeah,
people just knew each other, or like
for
in
sure.
Hollywood, I assume all the A-listers are together all the time. But
Yeah,
what a wonderful, easy thing at a time that was filled with so much uncertainty and confusion.
eternity.
So,
Yeah,
grateful for these doctors who are willing to say, like, here's where I feel we are, and this is where I want to get you, and there's somebody better for that.
exactly.
So thank you so much for sharing that. So,
Thank you.
folks, please be sure that I'm sure these questions are popping into your head about how all these different ways to find clinical trials. I also would love to point you in the direction of clinicaltrials.gov, or just as Ashley had mentioned, the power of social media, following places like the Sarcoma Alliance or other folks who may be, an advocate and looking at their diagnosis. And if it's similar to your own or the same as your own, could open up some untraditional pathways if you don't have, as Ashley has pointed to, like a really beautiful kind of coincidence. You stumble across this video, and all of a sudden you're in limb sparing surgery, which is wonderful. I will also just chime in a little bit here about the clinical trial that I was involved with. We heard a bit before the break from Dr. Garcia about compassionate access, and that's actually how I received the drug that I was treated with. And it was a very complicated process. Thankfully, none of it was on my end. But as I was wrapping up my year of doxorubicin, and we knew that we needed to manage and have sustained care because we were seeing a little bit of shrinkage in my tumor, but not a ton. My oncologist, Dr. Lee Hartner at Penn, who's spectacular, he was able to submit for compassionate access. And to my understanding, that is a kind of one-on-one protocol that he submitted to the FDA. And I will say that it took a lot of time at that point because we were just in the early pandemic. It was I finished up doxorubicin at the end of February of 2020, and they were submitting that paperwork, and it took a long turnaround time. But on compassionate access, you know that you're receiving the drug, and I am so grateful that today that drug was the first FDA approved drug for desmoid tumor treatment. I'm still on it today, and my tumor continues to be stable. So I had yet another kind of circuitous route to get there. But I'm so grateful for all of the trials that are run and all the folks who, whether they're receiving the experimental treatment or the drug itself, we are all a part of this process. And hopefully you're seeing yourself kind of represented in the different faces on our screen here. I have some individual questions. Ashley, could you tell us a little bit more with how, you said you were treated at this pediatric
care floor, which sounds like it must have been so intense and so emotionally wrought, especially at that time. How has the pass off into survivorship with like long-term adult care, what does that look like for you?
Really interesting and really,
Mm.
really different in the pediatric care. Something that I talked about at CancerCon with a couple of friends a few years ago was just the stark difference between pediatric centers and adult centers. And they could be much more gray and less inviting than the kid centers, which have like paintings and all of these different programs. And at the time in 2020, they had shut down a lot of those extra programs because of the pandemic. And I remember getting to participate in some of the things with the patients, trying to bring it back to the floor as someone who was older and had resources with lots of friends and things like that, which is really special. But I do really want to eventually like kind of advocate for more of the adult care to have more resources and things like that to
Mhm.
continue boosting morale because it can be a tough environment to be at even as an older person. And I'm really grateful for resources like Wendy Walk and the Sarcoma Alliance and others that have kind of really broadened the young adult space for cancer survivors to have that support. So the transition was definitely difficult, I will say, because it was so different. But I found so many amazing friends who are working to make it better, which has made it really wonderful. I also, just to kind of piggyback on what I said before, I moved from Dr. Sang and Kaiser to a sarcoma specialist in Santa Monica, Dr. Chawla, which was also a really good experience. I had the chemo backpack on me at all times, unlike what I did before in the clinical trial, where I was hospitalized for a few days and then went home and then back and forth. So it was a really different experience there as well, but it did give me more flexibility to continue working, and
Mm.
growing friendships and building my life while also having the chemo on my back. So interesting transition there, definitely pros and cons to both. Um, but it's nice that there's like a diverse range of treatment options that you have to fit whatever lifestyle you're in.
Oh, I love that point, Ashley. And like that is so important when we are looking at trials. There is oftentimes there's different kinds of trials we can
Yeah.
enroll in, right?
Hmm.
So I see that there's a question that's coming into the chat about how did you get comfortable in the trial that you're
Yeah.
enrolling into? It sounds like
Yeah.
for you, like, being a little different, having the chemo backpack, it sounds like you were able to look for some benefits in terms of like, well, this is
Yeah.
what it's allowing me to do.
I also want to say it's so interesting because my surgeon, Dr. William Sang at City of Hope, has been the one to follow my care all of these years,
Oh,
which is really
okay.
interesting because you think it would be the oncologist who was also great, but I think he was just super duper busy and I really bonded with my surgeon. And so he's the one that's followed up on my care. I even went from USC to City of Hope in Duarte, California, so he can continue seeing me. I just saw the
Wow.
question about oncologists and surgeons. It's
I
so
was just gonna
important
say,
that
perfect
the team
timing
works
there.
together. Yeah, and my radiation was also at USC. It helps if it's all in one. It was tough looking back that I was at Kaiser and USC and City of Hope. It's
Mm.
really great if it's in one system. But I was really grateful that all of my like team members and staff who were working on my care coordinated well and were able to communicate with each other. And then one other thing, I also really recommend having a trusted family member or partner. My partner at the time, who's still my partner today, he really was so amazing at looking at all of the documentation on the trials because I was so stressed and under so much pressure. I was losing my hair, I was going through surgery, chemo, radiation, and just did not have the mental capacity to read through all of the packet of, oh, all of this could happen to you on the trial, which honestly, like lots of different symptoms that could have happened and side effects from even the standard treatment didn't end up happening. But I think if I would have read them in the packet, I would have like made them in my head happen anyway. So it was really
Mm.
to have someone else read it and trust them with like, okay, they're monitoring me. If they see any of these things, we're going to call the doctor, but I'm going to try not to stress about it. Because even when I heard I couldn't have grapefruit on medication and I accidentally had a LaCroix that was like La Pampas, which apparently means grapefruit in French. I was
Yes.
texting my oncologist and I was like, I had a grapefruit LaCroix. And he's like, you're fine. You're okay. But like, I don't think I would have been able to handle reading through all of that stuff myself. So definitely have a support system that can help you work through.
Great, great practical question, practical piece of advice. And I do think that there should be some sort of t-shirt marketed for different, medications where it's like can't have grapefruit club, So I'm in that
Right.
one
Can't
as
have
well.
grapefruit. Yeah.
Wes, tell us a little bit more about what the challenges. We heard that your pass off was really great, but what were the challenges about the trial protocol itself? And perhaps, and this wasn't something we had planned on, but Ashley mentioned that her partner was incredibly supportive at this time. Did you have a rotating team of people? Did you have one person that was kind of your go-to? So I guess the questions are both most challenging aspect of your trial and who is really there as the person you're like go to, or who is on your team of emotional support people.
Yes, thank you. I would say the most challenging piece of the entire clinical trial is one of the three chemos that were added onto my treatment called irinotecan.
Mm.
Irinotecan, just the amount of side effects that hit me kind of aggressively with aggressive fatigue, loss of appetite, everything that you hear of. And it hit me really, really hard. So after cycle number 12, we decided to remove irinotecan from my treatment, and it's been
Okay.
going well without taking it and just doing the trial drug and topazoid as well. In regards to support team, that's where the reason why I think I'm still here and in such a positive light is because of the people around me. I feel I'm surrounded by a whole bunch, like a lot of cousins around the same age. I have two siblings. I've been there through thick and thin. You just name it. My mom's very active. Couple aunts and uncles. Whatever I needed. If I needed to be driven to an appointment, I never have to worry. Never have to worry about finding this on my own, which has been nothing
Wow.
but and awesome.
That is what every patient deserves. I'm so happy to hear that about your experience. And I'm also glad that they were able to remove what seems like one of the drugs in combination that was giving you so many of the side effects. Can you tell us a bit more about that? Was that a process of more self-advocacy, or was it your treating oncologist that would suggest that? What is that like?
Yeah, so I brought it up to my oncologist, Doctor get Manga, and we both agreed that with the practice or doing regular CT scans and removing irinotecan, and if my CT scans continued to come back clean, then it was worth it. Then we could definitely remove irinotecan and take it from there. So it was. I brought it up and we agreed upon it. So it was a great deal, a good deal.
Beautiful. Yeah. And such a great example of like when you have a great relationship with your care provider, the things that
Yeah.
are possible. And I count myself in that club as well. I've been seeing the same oncologist since I was diagnosed 8.5 years ago. And I can't imagine going to somebody else. Like
No.
he knows that, like, I get final veto power. We go back and forth sometimes, but all in this like really loving environment. So it sounds like you are in wonderful hands with an incredible care partner in your oncologist and also a beautiful support system as well. So let this be another great takeaway, folks, having like family members or chosen family members, right? Because they don't need to be biologically related to you to be the best support person for the job. And, connecting with your network will help bring people out of the woodwork who are excited to drop off, homemade chicken soup or something when that's what you really need. Or like, hey, I'm dropping off some Gatorade. Those are the people that you want. Thank you. And Brad, tell us about the trial drug becoming your current protocol. How did that transition happen? Because I think that's what so many of us um, might not be aware of. I certainly wasn't aware of it. That like if it's working for you, there's hope beyond just the trial end date. Can you speak more to that for us?
Yeah, like it's been 4 years or 5 years, honestly, and there was about a year where I didn't do anything. The first time was compassionate use, which I heard Dr. was it Garcia earlier talk
Yeah.
about.
Hmm.
Yeah, the manufacturer, and God, I wish I could say their name. It's a popular one. It is, but they've been like you. Luckily, I didn't have much to deal with that aspect of it.
Great.
You
Hmm.
know, they were just
Yep, that's
handling it
what you
behind the
want.
scenes, and I was just
Something
like,
off your
just let,
plate.
yeah, let me know when you want me to be there, and when you want me to stick my arm out. Let's go. Yeah. So, but I think I want to say now the drugs which I put in the chat are approved, so it's fine. Like it's going to continue to be my treatment as long as I need it. Um,
Great.
yeah, yeah, but
So it
that's
sounds
yeah.
like from in your experience between your supervising oncologist, the manufacturer, everybody
Hmm.
was kind of working behind the scenes to
Yeah,
make it quite seamless for you.
yeah, yeah,
Amazing.
yeah, and I'm not in the weeds when it comes to this. I'm kind of like ignorance is bliss, and I believe
Mm,
everyone's different. For me,
yeah.
that's what keeps me kind of going, keeps my head straight, and Dr. Van Tine has always been like, we'll handle all that stuff. You just live your life. Um, the bad part of that is I am ignorant to a lot of the processes. I had to look up compassionate use before this because I couldn't remember the name of it, but I knew I had to Google it. But yeah, yeah. So they've, I mean, they're pretty much my primary doctor now.
Same. Yeah.
Yeah, I mean, it's like, oh, I have a rash. I'll send them a picture. It's for everything. The portal is my friend, and
Absolutely.
yeah, and
But Brad,
yeah,
I
go
think
ahead.
that you're offering a lot of hope in saying it doesn't have to become a full-time job to administrate this long-term care. Like there's, like you said, everyone is different, but
Yeah,
in my mind, how wonderful that there's been an experience created for you where you don't have to be in the weeds. And that's an important experience
yeah,
for us to hear as a counter narrative because so many of us end up in this place where like we like you did. Like it took us a while to find a sarcoma specialist.
hmm,
And by the time we did, we were feeling really overrun and exhausted physically and emotionally. So I think it's a very positive thing that you haven't had to give a ton of concern or worry to it.
oh yeah, for sure. I mean, I still have I battle, fear and things like that.
Hmm.
For the most part, what was I going to say? I don't even remember what I was going to say. Um, I forgot what I was going to say. But
Well, when it comes
anyway,
back, be sure to
it,
interrupt me because I did
yeah.
interrupt you to like point
No,
something
what did
out.
you
So
ask
it's
me
only fair.
again? What did you
Um,
ask me? Oh! I do want to provide hope. I even debated whether I was
Beautiful.
going to do this panel or not, but I do feel very fortunate. I'm fortunate that the treatment worked for me. I'm fortunate to have great oncologists and great doctors, and I do want to provide, hope to other people that are other patients that are dealing with sarcomas because you don't read a lot of positive outcomes, unfortunately, and
Correct.
that's cancer in general. That's just not sarcoma. That's just in general. And there are a lot of positive stories out there that I believe I wanted to put mine out there, and I have done it on YouTube. You could find it. It's called My Tour de Cancer. I used to be a bike racer, and I compared my journey to the Tour de France, and so just Google My Tour de Cancer. You can find it. Yeah,
Incredible name. I love it.
yeah. I don't want to update it, but honestly, I did it to get it off my chest.
Mhm.
and to offer hope. And I didn't even, you won't find it under Brad Anderson. It's under another name that I use for my social media stuff. But that's the main thing is what I'm trying to do is just offer hope
I
and
love that.
thank Dr. Van Tine. I mean, he's not with us anymore, unfortunately, but he's passed me off to some good doctors. And I did want to say this as well. Like I'm in Memphis, but there's a job that I recently applied for in Florida, and I told Dr. Mia Weiss is my new doctor, who trained under Dr. Van Tine, and she immediately said, "Well, if you get that job, Birmingham, Alabama, like Wes was saying, and it's going to be an easy handoff." And it's
Great.
actually a doctor I met that I started. She was a fellow when I started 5 years ago who left
Wow.
St. Louis to go to Birmingham, and it's actually going to be closer. And it's actually closer to me now, but I don't want to mess with what's working, so I'm going to
Sure.
keep going to St. Louis. But anyway, yeah. So
Well,
that's a
talk
similar
about
story.
offering hope, Brad, because that's not just like hope for the immediate, but like, should you need to make this life change, should you end up needing to relocate for your job, like that is the hope, is that our treatment can just be folded into our life, that like that we can continue living and not
Yeah.
just I felt for a long time like my identity was really reduced to patient. And I
Mm.
have gained so much hope in the last several years as I've been able to add activities back into my life that I
Oh
didn't think
yeah.
I'd be able to do again. So that's incredible hope. So thank you for offering that as
Hmm.
well. And yeah, I know there's some gratitude in the chat for sharing positive stories. We need to be aware of these, right? We need to know about the possibility for success, however we wish to define that. I do want to, we will be getting to audience questions and answers, and we've touched on certain things briefly, looking about like getting comfortable with clinical trial, the one that you choose, the relationship between treating oncologists and surgeons with disease specific experience. So we will get to those, but I thought this was a fantastic question. It was suggested that we ask you all, what are practical tips or tricks that helped you during your trial experience? So I'll go first, and this is very practical. Mine was an oral chemotherapy, so I would have to keep a log. So many mornings I'd be running around being like, where did I put that packet? So if I had to go back and start over again, I would have a designated place, like maybe a brightly colored folder where I would keep my packet, probably next to the coffee machine or my tea, because that's how I'm starting every morning. And that's where I'd write down, what time I took the drug, because I was required to submit that log. So, practical tip from me is if you're required to do any sort of daily documentation, make it easy for yourself. Set yourself up for success and make that accessible and keep it where you know you'll see it every day. Les, let's hear from you. Do you have any practical tips and tricks, even if it was specific to your trial, that you would suggest our community be aware of?
For sure. I am a uh, rep, repetition by nature, just in general. So
Hmm.
having stuff scheduled and repetitive definitely helped me out drastically. And I think it's just a trait that I picked up just by through work and all, but it has definitely helped my staying organized with the clinical trial and making sure I'm always on top of my appointments, my taking the medicine, all that good stuff. So having a schedule and sticking to it for sure will be it's my tip for sure.
I love that. And also, if you are not you, meaning the royal you, the community members, if you are not an organized person by nature, that's a great opportunity to pull somebody in and be like, "Hey, can you help me with this? Can you help me create a calendar? These are the things I need to put on there." So, if that's something that you can delegate, do it. I'm really a big fan of offloading whatever work you can so that you can just work on our physical healing. So, Wes, thank you. That's a really great suggestion. Ashley, can you tell us, was there a practical tip or trick that you'd suggest?
Yeah, it's funny. I was like just looking at my partner. I'm like, what did we do? What was helpful? I think definitely letting people know what you need because a lot of people will be like, let me know what I
Mm,
can do. And it's like scary to be like, can you bring me to chemo or can you like bring lunch on this day? but people really do want to help. And being on the other side of it, I'm always grateful when I get to help someone else. And then on top of that, also just like, this is really, really niche and practical, but if you, for your specific sarcoma, I would look up the hashtag on Instagram because you'll
Love
find people
this.
who have the same sarcoma. And it's really random and weird. But I remember even when I was sitting in the waiting room at the Sarcoma Center in Santa Monica with Dr. Chawla, someone came up to me in the waiting room and they're like, I recognize you from Instagram, from the hashtag spindle cell rhabdomyosarcoma. Because there's not that many people, you know, it's a very
Right.
rare cancer. So I would say go on the hashtag sarcoma or rhabdomyosarcoma or desmoid tumor, whatever it is, and find other people who are going through it because a lot of times you also might even have the same doctor, the same care. You might have gone to City of Hope or MD Anderson. And even when I went to Relay for Life 1 year in Bakersfield and met Sweet Natasha. She has since passed, but she wrote a book on sarcoma, these sarcoma scars, which you can find on Amazon. She was just like a breath of sunshine and light personified. And we met at Relay for Life and found out that we had the same doctor. And so then she would drive from Bakersfield to Santa Monica. I would drive from Pasadena to Santa Monica, aka my sweet friends and partner would drive me. But and then we became friends through that and kept up on Instagram. So really use social media as a resource. It's one of, even with all the hard things with social media, it's one of the positive things on there. And go to Relay for Life, go to events, go to CancerCon. It's so worth it and it's so much fun. And it's like Christina said at the beginning, it's not a great club you want to be in, but the people are just amazing. And they make the experience so much easier. So yeah, that's it.
I love both of those practical suggestions. Definitely. I mean, Ashley, I'm sure that we found each other through hashtag
Yeah.
sarcoma.
Yeah. Oh,
It's like
yeah.
I couldn't pinpoint it, but
So
I'm
weird.
certain that's
Yeah.
probably the one.
Yes.
I
Hmm.
wish we could have met another way, but this was,
Same.
if you
Yeah.
have to be in this club,
Yeah.
find yourself some good people. And
Yeah.
also, yeah, like really activating your community. You are not going to get a gold star for going through this alone, right?
No.
If we deny the
Invite people
offers
in.
of like a meal train or whatever, nobody comes to give you an award for that. So take them
No.
up on it.
Yeah, it's so true. Also, just replying to the girl who said she also has rhabdomyosarcoma. I don't know if there's a way that we could all send our emails, but or you can find me on Instagram at Ashley Kendall Jones too. But please, everyone, reach out for any specific thing as well.
I'm telling you, this is such a generous community, y'all. I'm really glad that we're even using this as an opportunity to get folks connected. I
Mhm.
will add on just very quickly something that I did in my early days in terms of learning how to ask for help because it took me many years. I just started keeping a note on my phone so that I didn't have to sit and do the mental labor of like, well, what actually do I need? Do I need
Right.
somebody to come walk my dog this week? Could I really use a delivery of some food? Is it, a certain electrolyte powder I'm looking for? I just started keeping it all in that note in my phone so I could just copy paste it over and let people know that there were ongoing things I was looking for. So, really wonderful suggestion. Brad, how about you before we turn over to our audience questions? Do you have any practical tips or tricks for us?
I think what I'm gonna go on is just the mental aspect of
Mm,
survival of it, because that's physically I haven't had any side effects, which is great.
hmm
So I've been able to go on normally. Mentally, I felt it was important. Everyone's different, you know what I'm saying? Like ignorance is bliss is for me might not be what someone else needs to be. And most, well, I think the majority like to be doing looking, researching, networking.
Right.
For me, I didn't want cancer to be my identity. I think you mentioned that earlier.
Yeah.
But I guess what I'm getting at is do like for me I'm an artist, so it's important to create and keep my mind off of it,
Mhm.
Mm,
keep looking
Yeah,
forward
for
to
sure.
things. I started a YouTube page, I started a podcast. I did a lot of things I was afraid to do pre-cancer that post-cancer not afraid to do. And putting my energy into that, putting my energy into creating music, to create interviewing people and my podcast, making videos, things that when I wake up in the morning, I'm thinking about those things and not cancer. The other thing is I've developed another life in St. Louis, which I look forward to. Like I'll treat myself to certain things on treatment day, you know?
Yes, I love this little
Yeah.
treat magic.
Yeah, like there's certain things I'll go to a record store and I'll buy a CD for on treatment day. Like that, I have a big CD collection right next to me. Or I might eat something unhealthy, or I might go to Starbucks way too many times,
Yes.
things like that, so it's not like dreading another infusion, which isn't bad, but it's more so looking forward to the other things around the treatment.
Totally agree. Oh, Brad, thank you so much for bringing both of those parts up. Like making sure that there is something we feel tethered to that is not directly tied into our cancer experience. Creativity is that for me as well. I have a degree in theater arts and theater education. So that tends to be my pathway as well. But maybe it's something different for all of you out there. Maybe you're like really into the World Cup right now and now you're finding new teams to follow along. Like there is nothing niche enough when you are going through cancer treatment. And I will also say I'm a big believer in like little treat magic. I go to the same cafe and get my matcha iced or hot, after every one of my appointments because it gives me something to look forward to. Like no matter how the appointment goes, I'm gonna have this like delicious matcha from Tallulah's. So thank you for highlighting the importance of that, as well as mental health in general. Mental health is as important as our physical health. And let's continue to talk about that so we can break down some of this stigma, especially surrounding this idea of patients being like, unstoppable or never complaining, right? It's okay to feel like we're having a hard time with things, and it's okay to complain as well. So I'm writing you that permission slip, everyone in the audience, if you feel as though you need it and that's speaking to you. With so many different questions, I'm going to just read through them as I see them. I know that our folks here have found options. It sounded like, Brad, in your experience, Wes, in your experience, there was kind of that immediate handoff right to your doctors where it was, and also a matter of like, time is of the essence. We need to get you this treatment quickly. But there are also trials that don't necessarily involve just a trial drug, right? It could be a trial of mental health, a trial where, what is it like when you're tracking your side effects or your symptoms? How did you know, Ashley, that even though you were on the control drug, that the trial was still right for you?
I think at that point, I realized like, okay, well, this is a rare disease and it's for research. And at
Mm,
the time, this is like also before this is like right at the beginning of my diagnosis before I did much research. I was just like, okay, this is what they say is going to work. I'm going to do it. So I think for me, it was partially like feeling like I needed to do something because this was
yes.
urgent and it needed to happen. And then also excited still to participate in the research of it because it gives you
Yep.
like a sense of purpose and meaning in a time where it can feel really stripped from you because you're taking a break from work and your job looks different and your hobbies look different. And so I think I felt like it was right for me because I was like, okay, this is a hard thing, but maybe we can find like a small, tiny silver lining of getting to propel research forward for other people.
What a beautiful response. And I feel that from every panelist here, Brad talking about the importance of sharing his hope. Wes, you and all
Mm.
of reading Wes, your bio is just like absolutely incredible. So I encourage folks that haven't connected with Wes, if you want to learn more, please do reach out. But every panelist here has contributed to the greater body of research that is only going to better things for the next sarcoma patient behind us. And even if you are, somebody with a rare diagnosis, as someone with a rare diagnosis myself, I've explained many times, what works for a rare disease often then goes on to benefit so many other things. So even if it's just a specific type of sarcoma, it could end up that there's a carcinoma patient that might benefit from this research. So I love that idea about connecting to some kind of purpose greater beyond just our own experiences. Talking about relationships between surgeons with disease-specific experience and oncologists. I'm actually going to hop in here because so my diagnosis, a desmoid tumor. Desmoid tumors recur very frequently in patients because you can't get really good margins on them. Some people have a surgery and they're very successful, but even under the microscope, it's called. They talk to it about it like an octopus, like having lots of different tendrils that it unleashes. So even when I saw a surgeon with experience in treating desmoid tumors, he really wanted to cut me open. He really wanted to try to take this thing out. And it wasn't until the oncologist put on the brakes. And I will say, speaking to the advantages of having a team that cooperates with each other, I'm so grateful that my oncologist was like, yeah, I got a text from your surgeon. I'm not going to let him open you up. So just know that that's a possibility as well. If you find people who talk to each other, or your surgeon will hopefully say, I defer to what your oncologist says, or I would even suggest getting your case seen by a tumor board, because then you'll get a multidisciplinary approach to your diagnosis. Does anybody else? I don't want to not allow the opportunity for Ashley, West, Brad. Brad, would you like to add on to that?
Yeah, once again, the sarcoma specialist, finding one, because for me, before that, I was just being referenced to various surgeons and time was being wasted. And meanwhile, this thing was metastasizing. And I'm like, what the hell? It
Mm-hmm.
shouldn't take me long. Being at it now, everything is done there. All my surgeons are there. They all work together. They're all sarcoma specialists. They all know each other. So it's like a one-stop shop between radiation, surgery,
Yep.
treatment, um, clinical. So for me, it was a godsend. And once it's just another one of those things. So I know my surgeons know. Depending on what part of my body I've had surgery on, I've had many. They all know each other. They're all communicating. They all have the same spreadsheets, and it's worth the drive, I'll tell you.
Yeah, absolutely. And it leads us right into our third question, I would say. Somebody asked, is it really that important to have a sarcoma specialist? And I would say that only you, and it sounds like you're the caregiver for your daughter, only you can make that decision. What I would highly suggest, though, is even if you don't plan on transferring your treatment, getting that second opinion will never be time that's wasted. So I've been fortunate enough to get a second, third opinion at other major providing institutions, and they have all just confirmed the treatment path that I'm on with my current treating team and my oncologist. And for me, it was, again, as Brad said, it's worth the money. I was glad that I hopped on the train or hopped in the car and got those people just to say, you're in really good hands. I would keep doing what you're doing. That peace of mind is extraordinarily worth it. Is there anybody else here that would like to speak about the importance of a second opinion, or is that something that you've struggled with as well? Like, when is it time to seek a second opinion?
I would say that is something I really struggled with because getting a cancer diagnosis, my tumor was already huge. It was right here and it was the size of
We're
a
like
grapefruit.
twins. I know we
Yeah,
talked about this.
insane. It was huge when I found it. And so going to urgent care, then immediately going to another doctor, I was like, let's just get it out. Let's do the amputation. I was so panicked and I didn't want it to spread because every single day I was like, it could be spreading. And it
Hmm.
was my family and friends that slowed me down and were like, let's get a second opinion. Because once you lose your arm, that's it. Like that's permanent. And so it was really difficult to like take the time for a second opinion, but I'm so glad that I did because I had my family and friends around me being like, just like, let's do some research. And that's when I was inspired to like go on Instagram, look at sarcoma specialists, look at the experts, go to a UC system, try something outside of Kaiser. And my church actually supported me in switching my insurance, which was crazy because the
Amazing.
insurance part was
Yeah.
so insane. That was one of the most stressful parts of my cancer treatment was trying to like switch insurances partially the way through. And that was keeping me from getting a second opinion because I was in the insurance system of Kaiser and you had to get like permission to go outside of it. So do lots of research, incorporate family and friends, and make the calls because I think it's worth it, even if it takes a little bit more time. Of course, like definitely everyone's situation is different, but for me, I'm really glad that I took the time to get a second opinion.
Yeah, that's wonderful. Thank you for sharing that, Ashley. Brad, we know about your experience with ending up basically at your second opinion. Um, and I know that you're now transitioning to seeing a new doctor since the passing of your first oncologist.
Yeah.
So can you talk about what it sounds like they trained under Dr. Time, but is there something that made you feel really comfortable with them as well? Is there anything about their bedside manner or something you look for in particular to feel really comfortable?
Yeah. Eh, um, yeah. Dr. Mia Weiss did train under Dr. Van Tine, and unfortunately, unfortunately, when I heard the news about Dr. Van Tine, they reassured me that Dr. Weiss is a good option, and I can tell she does think like him, which is good.
Great.
So, yeah, I haven't gotten the job in Florida, so I'm still waiting on that. But they've become like my family, over there, and they know me, they know my mentality. So it was a smooth transition. Their bedside manners, great. I want to say this that the drive to St. Louis, 4 hours, 4.5 hours, it it takes less time when I was going locally to get treatment. Like because they're so
Oh,
good. I mean,
yeah.
I mean within 5 minutes, there's a needle in my arm. They're doing my blood test. I'm getting the results, and I'm looking at
Yep.
my phone, and the results are immediately. Oh, your thyroid's it. You know, everything is boom, boom, boom. There's a culture there where my local cancer clinic, it would be. I would have to take a day off of work.
Hmm.
So and I don't want to badmouth them, but yeah, it's just I don't know what it's like anywhere else, but for me, it's been great, and yeah, yeah, it's been
Well,
great.
I think that's incredible to have that for folks who are considering traveling, how it can become so efficient. I know that I have very tiny veins. I am a hard stick. So when folks need to access, I'm always I'm like, who has done it the most already today? Because I know they're not going to have a problem going in through the back of my hand because my elbows have never been my good spot. And right before we wrap up, Wes, was there ever a time when you considered getting another opinion, or what has made you feel confident in remaining with your treating oncologist?
Dr. Kristen Gandrew. I mean, she told me jump, I'd say how high type deal. She is such an awesome individual human being, and especially an oncologist. So she pointed me in the right direction, told me, I think it is in your best interest to check out this clinical trial being done at UCSF. And I ran with it. And like I said, her advice weighs heavily for sure.
Yeah, and again, what a beautiful relationship. It's one of the more unique ones
Yeah.
that we have. But finding a doctor who is a true partner in your health. Although I love what Laura just said, clinical relationships don't have to be monogamous. If you find the one, by all means, like lock that down, right? But it's
Yeah.
okay to kind of like date around. And I would say the same with mental health care, right? There might be a time if we're seeing a therapist who maybe not be as familiar with our cancer or our survivorship, if that becomes more important to you, seek out somebody who has an expertise with that, just like you would a specialist in your sarcoma care. Well, I know that we are just about out of time. I just want to thank all of our panelists so much. Wes, Ashley, Brad, each of you has contributed so much to this conversation. Thank you for your time, your energy. I have learned so much from you, and I'm really grateful for everything that you've shared with our community.
Thank you, Christina. Thank you for
Hosting.
on this.
Thanks for
Yeah.
hosting, Christina.
Thank you. Thanks, everybody.
Nice to meet you guys.
Keep hope alive.
Thank you all so very much. That was incredible. Christina, amazing facilitation. To all our panelists, absolutely incredible information. We can't thank you guys enough. That was awesome. So that's going to wrap it up for us today. Thank you all for joining us. We hope you found some insight, education, and optimism through everything that you heard today. We do encourage you to stay connected with the community. The Sarcoma Alliance truly exists to help get those second opinions. We are a patient-focused organization, and we would love nothing more than to give and help all members that are going through this help in getting a second opinion and finding a sarcoma specialist. So if you are considering that, please come to our website, apply for a second opinion grant, and we are here to help you. You are not alone in your fight. Thank you so much for being with us today.